Right, the maxillary nerve, or V2, is somatic sensory only. It originates from the trigeminal ganglion in the cranial cavity, and it exits the middle cranial fossa through the foramen rotundum, so this one here, and it gets into the pterygopalatine fossa. Then it goes anteriorly and exits as the infraorbital nerve through the inferior orbital fissure. In general, this nerve supplies the dura mater of the anterior part of the middle cranial fossa, the conjunctiva of the inferior eyelid, the mucosa of the posterior and inferior part of the nasal cavity, the maxillary sinus as well, hard and soft palate, the maxillary teeth, anterior part of the oral vestibule superiorly, and the skin of the lateral external nose, the inferior eyelid, anterior cheek, the skin of it, and also the upper lip. So the branches, I know this slide is like with a lot of wording, so not very nice, but these are the branches of the maxillary nerve. So just as a kind of summary. So the first one is the meningeal branch, then the zygomatic nerve, which gives the zygomatico-facial branch, the zygomatico-temporal branch, and the communicating branch to the lacrimal nerve. Ganglionic branches to the sensory root of the pterygopalatine ganglion, posterior superior alveolar nerves or branches, infraorbital nerve with that gives the anterior and middle superior alveolar branches, superior labial branches, inferior palpebral branches, and external nasal branches. The greater palatine nerves that gives the posterior, inferior, lateral nasal nerves. Then the lesser palatine nerves, the posterior, superior, lateral nasal branches, nasopalatine nerve, and the pharyngeal nerve. So while passing through the pterygopalatine fossa, which is this space here, the maxillary nerve gives off the zygomatic nerve, that one there, the posterior superior alveolar nerve here, two ganglionic branches which originate from its inferior surface and pass through the pterygopalatine ganglion, this one here, and we will have a look of these nerves a bit later. To understand this region, the pterygopalatine fossa, I've always thought about it like a room, and then the pterygomaxillary fissure will be the like the borders of the door, so the frame of the door. And once you get into this room, you will get into the pterygopalatine fossa. So the branches of the maxillary nerve. We will start with the greater and lesser palatine nerves that will pass inferiorly from the pterygopalatine ganglion, then go through the palatine canal and travel through the greater and lesser palatine foramina. They will innervate the mucosa and glands of the hard palate and the adjacent gingiva. The lesser palatine nerves will run posteriorly to innervate the soft palate. The nasopalatine nerve, this is the largest of the nasal nerve that innervate the middle wall of the nasal cavity, and it travels anteriorly and inferiorly down the nasal septum and then passes through this incisive canal and fossa and gets into the, through the hard palate and gets into the roof of the oral cavity and supply the mucosa, the gingiva, and the gland near to the incisors. Now, at the pterygopalatine fossa, the maxillary nerve will give off the posterior superior alveolar nerve, which then exits through the pterygomaxillary fissure to enter into the infratemporal fossa, and it then travels laterally and inferiorly to enter the posterior surface of the maxilla through a small foramen and then passes inferiorly deep to the mucosa, like this, of the maxillary sinus, and will join the superior dental plexus. So the posterior superior alveolar nerve will innervate the maxillary sinus, the molar teeth, and its adjacent buccal gingiva. The infraorbital nerve leaves the pterygopalatine fossa through the inferior orbital fissure. It runs through the infraorbital groove in the floor of the orbit and then goes anteriorly in the infraorbital canal. In the infraorbital groove and also in the canal, it gives two branches, the middle, this one here, and the anterior superior alveolar nerves. Both of them will join finally the superior alveolar plexus to supply the upper teeth, and the middle superior alveolar nerve also innervates the maxillary sinus. Now the nerve of the pterygoid canal. This one is originated in the middle cranial fossa. When the greater and the deep petrosal nerve, so the greater petrosal nerve is a branch of the facial nerve, and the deep petrosal nerve is a branch of the internal carotid plexus, and when they meet, they will create the nerve of the pterygoid canal. Then this nerve goes into the pterygopalatine fossa, where it joins the pterygopalatine ganglion and carry preganglionic parasympathetic and postganglionic sympathetic fibers. So branches that are of the maxillary nerve and that carry parasympathetic fibers are the zygomatic nerve, the greater palatine nerve, the lesser palatine nerve, and the nasopalatine nerves. And here we have a diagram from Netters of the pterygopalatine fossa. And I like this diagram because it simplifies the different walls of the fossa and what passes through each of the foramina. For instance, this one, the red one, is the posterior wall, and we know that the maxillary nerve exits the middle cranial cavity through the foramen rotundum. So here we have the foramen rotundum, and the same here, this wall, the posterior one. Here we have the name of the nerve that passes through it. So this one is the maxillary division of the trigeminal nerve. Right. So now we will begin with the maxillary division. And the mandibular division. And I took this caption from Complete Anatomy as I wanted to show the foramen ovale from another perspective. So this is an inferior view of the external aspect of the base of the skull. And here we can see its relation with the infratemporal fossa. And in the right side, an image of the mandibular nerve exiting the foramen ovale. So this is kind of an inferolateral view. This is more inferior. The same view here in the left side with the mandibular nerve at the foramen ovale, and here in the right side we can see this motor root, which is this one here in the left, that passes medial to the trigeminal ganglion in the cranial cavity, and then passes through the foramen ovale and immediately joins the sensory part of the trigeminal nerve. Now this is a lateral view, and here we have the trigeminal nerve, or the branches of it, but I want to focus on the mandibular nerve only. So after it exits through the foramen ovale, we can see how this one will get into the infratemporal fossa, which is this part here. And this is what we have in this yellow circle here. So the mandibular nerve carries sensory, somatic or somatic sensory, and also somatic motor fibers. Hence, this is a mixed cranial nerve, and all the branches of the mandibular nerve are originated here in the infratemporal fossa. And it gives an anterior and a posterior division, and I have highlighted them here. So in the left side, we have the anterior division, and in the right side here, we have the posterior division. And to simplify it, I have this representation of the different branches. It gives two branches. First, the sensory one, which is this one, the meningeal branch, or nerve spinosus, which will enter through the foramen spinosus. And it also gives a motor branch, which is this one, the nerve to the medial pterygoid. Then it gives the anterior and the posterior division that we have just seen before. And each division gives four branches. The branches of the anterior division are mainly motor, and these are the deep temporal nerve, the nerve to the masseter muscle, the nerve to the lateral pterygoid, and the buccal nerve, which is the only sensory one. And the branches of the posterior division are mainly sensory, and they are the auriculotemporal nerve, the lingual inferior alveolar nerve, and the nerve to the mylohyoid muscle, which is the only motor in this division. So the mandibular nerve will supply sensory innervation to the skin of the lower face, also the skin of the part of the cheek, the lower lip, the anterior part of the external ear, the tympanic membrane as well, part of the external acoustic meatus, and also the temporal regions. In terms of the tongue, it will innervate the anterior two-thirds of the tongue. The teeth that are located in the mandible, so the lower teeth, the mastoid air cells, mucous membranes of the cheek, also the mandible, dura mater in the middle cranial fossa, and mucosa of the floor of the oral cavity. So here we have muscles or the picture or diagram of the muscles of the mastication. Please remember that all the muscles of the mastication are innervated by the trigeminal nerve and the mandibular division. A left picture with a lateral view where we can see the two muscles, the temporalis and the masseter here. And in this picture is a posterior view where we can see the medial, this one here, and the lateral pterygoids. The temporalis there is getting attached to the coronoid process, and the masseter here. In this image here, we can see the meningeal branch, which is this one there that is entering the foramen spinosus. And the branches of the anterior division, the deep temporal nerve, the nerve to the masseter, nerve to the lateral pterygoid, which is that one there, and also the buccal nerve. And here we have the branches of the posterior division with the auriculotemporal nerve, the lingual nerve, inferior alveolar, and the nerve to the mylohyoid muscle. So note here the disposition of the lingual nerve and the inferior alveolar nerve. The lingual nerve runs anterior to the inferior alveolar nerve, and you can see this in the prosectorium, in the one of the tables where you can see the muscles of the mastication. The mandible has been resected there, so please have a look and try to find which are the branches here of the mandibular nerve, so you will always find the lingual nerve anterior to the inferior alveolar nerve. And then this inferior alveolar nerve enters the mandibular canal at the level of the lingula and runs within the mandible, giving off its terminal branch, which is the mental nerve. Now, this image will summarize the sensory innervation of the oral cavity. In the left side, we have the innervation of the teeth, and these are the nerves we will look to block when it's needed for a restoration only. And on the other side, in the right side, this will show as well the nerves that we will need to block when we need to anesthetize the soft tissues or the gingiva. So for example, when we're doing an extraction. Remember that the injections should not be performed in areas of infection or inflammation. And it is important to consider that the mandible is composed of two plates of thick cortical bone, the lingual and the buccal plate. So to achieve the anesthesia, we need to inject the solution before the nerve enters the mandibular foramen. And that is why we need to know the location of the lingula, whereas the maxillary or the maxilla is a porous bone, so the solution will be absorbed, and this helps us a lot in achieving the anesthesia of the maxillary teeth. So the Lower teeth are innervated by the inferior alveolar nerve, and the upper teeth are innervated by the anterior, middle, and posterior superior alveolar nerves. The lingual mucosa in the mandible is innervated by the lingual nerve there, but the buccal is innervated or innervating posteriorly, and anteriorly the buccal surface as well is innervated by the mental nerve, which is a branch of the inferior alveolar nerve. Then the hard palate is supplied by the nasopalatine nerve and greater palatine nerve, and the buccal gingiva, so a bit more laterally here, is innervated as the teeth, so from the branches of the anterior, middle, and posterior superior alveolar nerves.